Welcome everyone to today's webinar. I am Mackenzie Bean with Becker's Healthcare. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your questions box labeled Q&A. We are looking forward to hearing your questions. Additionally, following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenter. Marvella Thomas has 35 years of clinical experience in healthcare institutions. Much of her experience as a clinical leader includes management roles in surgical, central sterile, and administrative services at acute and ambulatory facilities. In her clinical management roles, she was responsible for department planning, organizational effectiveness, and staff development. Ms. Thomas was also accountable for driving results that included fiscal and quality improvement activities, where major emphasis was placed on supply chain efficiency and inventory management. She has also managed throughout 2 new facility construction projects. Ms. Thomas joined Cardinal Health in 1998 as a clinical consultant with the Pre-Source Division. In 2001, she assumed management responsibilities for the clinical and logistics team in the Central Midwest region. Account activities have included supply chain, inventory, and equipment or instrument management for national and international accounts. She joined the national accounts team within Cardinal Health's ambulatory division in 2015. Currently, as senior consultant, she conducts operational assessments focused on process improvement, supply chain management, and space utilization. Marvella, I'll now turn the floor over to you.
Thanks, Mackenzie. As mentioned, I'm Marvella Thomas, a registered nurse and senior consultant for clinical operations in the ambulatory surgery division at Cardinal Health. And I'm excited to speak with you today about ways to more effectively manage your ambulatory center's OR inventory. Over the next 40 minutes or so, we're going to discuss specific strategies that can help you manage your operating room inventory more effectively. That's especially important right now, as ambulatory centers just like yours are challenged like never before to lower costs while maintaining patient throughput and a high quality of care. After this presentation, you should be better prepared to discuss why supply management in your operating room is important, to describe the challenges of effective OR supply management, to review current processes, including your clinical practices that affect and help you manage OR supplies. We're going to outline strategies to improve OR inventory management. In particular, we're going to discuss how you can uncover hidden waste and actually drive cost savings. And as well, we'll review how best practices from centers across the country can be customized to meet your own center's challenges. And lastly, we're going to discuss and review the roles and responsibilities of perioperative nurses in effectively managing OR supplies. So let's get started by sharing why Cardinal Health is uniquely qualified to help your ambulatory center improve processes, lower costs, support patient safety initiatives, and streamline inventory management. With more than 40 years of experience, Cardinal Health is a recognized leader in transforming the healthcare supply chain to meet new challenges around costs, revenues, and outcomes. In particular, Cardinal Health is the leading med-surg distributor for the ambulatory market. Our clinical team of perioperative nurses has over an average of 20 years of OR and supply chain management experience. And we're all here to help ambulatory surgery centers cut waste and OR costs, both now and in the future. And the prime target for those cost savings is your supply spend. So let's take a look at the numbers. For an average surgical suite, the average ambulatory surgery center spends $230,000 on supplies, and they keep between $100,000 and $120,000 per suite of inventory on hand, while your average inventory turn rate is just 4.8 times annually. As a percentage of net revenue, your ambulatory center supply costs are substantial, ranging somewhere between 17 and 25%. And supply management takes a toll on your staff as well. 25% of clinical staff time is spent on supply chain activities. A staggering statistic from a recent study at the University of California, San Francisco, put a price tag on supply waste in the OR. Almost $1,000 per procedure in that medical center. So although this study was done in an acute teaching facility, the trend should be considered when looking at what supply chain opportunities you have. So while supply costs pressures are a concern, so is the average ambulatory center's overall financial health, due to a lot of factors. Several financial pressures are impacting ambulatory centers today. For starters, you're paid nearly 50% less for the same service that's performed in a hospital outpatient department. At the same time, your revenues and profits are declining as reimbursements fall. And to the broader financial impact, that's yet unknown. So how is the shift in reimbursement from fee-for-service to value-based care going to ultimately impact your ambulatory center? So while the financial pressures loom large for ambulatory centers, so too does the opportunity. Because the fact is that patients and surgeons often prefer the ambulatory setting over hospitals, which can be overwhelming and hard to navigate. In contrast, an ambulatory setting can be more convenient, have better service, and for your patients, have lower out-of-pocket costs. So to keep service levels high and costs low, ambulatory centers need new ways to cut waste and lower cost. And focusing on your OR supply management is a prime opportunity. So where are these supplies? To uncover the waste, we first have to recognize what supplies are duplicated in many areas. In fact, the same supplies can be found in your surgical suites, an OR core area, on specialty carts and case carts, in your case pick area, and in bulk storage area. And then, of course, there are those other non-official stocking locations like nurses' locker rooms and the materials manager's office. 7+ locations where you can find exactly the same product. If you multiply this number by inventory dollars per operating room, the financial impact becomes overwhelming. So to cut this waste, ambulatory centers need a new approach to managing OR inventory. But you have several challenges to overcome first. Let's take a closer look. Managing OR inventory is no small undertaking. Some of your major challenges include the diversity of procedures. You're doing everything in your facilities from simple GI procedures to total joints and spines. You have to deal with physician preferences. There are typical practice issues that vary in your facility. Many of you have limited data, and there's a lack of preference card management, and sometimes a lack of preference cards altogether. As we discussed earlier, you have duplication of supplies. You have a lack of automated inventory control systems. And you're also housing and managing different categories of OR supplies. You're managing everything from Band-Aids to tissues and implants. So let's dig deeper into this first challenge, the diversity of procedures. Every day across the United States, there are thousands of procedures performed, and each one requires a variety of supplies. There's little, if any, consistency in what's used and why. For example, the cost of supplies for a simple laparoscopic procedure can vary by hundreds of dollars in different facilities. And while different facilities require different supplies, there are many basic commodity supplies that are required for all surgical procedures. However, few, if any, operating rooms have been willing to eliminate any supplies for fear of not having something the surgeon might request. In addition, our past practice was always more is better. Rarely would anyone run out of supplies in the operating room because historically the practice has been just in case, or JIC, instead of just in time. JIC means placing one on the shelf and one in the drawer just in case it's needed. So imagine the waste that this JIC purchasing creates. Now let's move on to physician preference items. A study has shown that surgeons seek four things from facilities. They want quality of care, they want efficiency, they want to have input into what's happening, and they want to have appreciation. So responding to physician preference requests demonstrates to surgeons that your facility values them, respects their time, cares about their patients, and wants them to have an efficient environment in which to work. So this supports the case that surgeon preferences do need to be considered when you're looking at standardizing products and optimizing your supply chain. At the same time, many products used in the OR may be clinically equivalent and could be standardized with little or no physician impact. So your physician preference issue is escalated in the ambulatory market due to competition. Your ASC's business development team often promises anything to get a physician on board without discussing the costs associated with physician preferences. So this is a disconnect that you really need to discuss and address with both your business development team, materials management, and administration. And it's also a perfect example of why it's important to elevate the level of qualities and requirements of potential materials managers when you're hiring for this position. They're going to have some really difficult conversations in the future. So let's take a look at typical practice issues in your facility that are a barrier to effective inventory management. Effective inventory management in the operating room has been at best marginal. Standing in the way are such issues as a lack of data to support your inventory levels. Nurses, perioperative nurses that open everything on the preference card just to ensure that the surgeon has everything he or she may want. It's the old just-in-case practice again. People who don't know and understand the operating room environment are sometimes the folks who are responsible for the purchasing and distribution of supplies. And there may be a lack of integration between your materials management team and your surgical services team. Few ORs have established PAR levels, and perioperative nurses are not inventory management specialists. In addition, the nurse is focused on the patient, not inventory management, and that's where it should be. And a lot of times your materials manager who's trying to drive cost savings and manage the inventory is often not valued by your clinical team. And in some facilities, the materials manager is also required to perform and function as clinical staff on a frequent basis, giving them less time to manage the inventory that they were hired to manage. Next, let's discuss the challenges of data. There are several gaps in data analysis in the ambulatory setting that are needed to be overcome. For example, there's a lack of quantifiable data regarding your supply usage and your inventory levels. There's lack of data that describes product duplication and your procedure costs by physician. Each issue has been a barrier in implementing processes that improve OR inventory management. Plus, the method of collecting data is still manual in many ORs. This lack of technology is hindering your ability to accurately determine where you are regarding your annual spend, your inventory levels, and your inventory turns. As a result, it's more difficult to set realistic goals. So as an example, let's focus on a critical component of inventory management that would benefit from a more robust data analytics platform, and that's your preference cards, or in some facilities, a lack of them. Physician preference cards have guided perioperative nurses for years. The challenge is that many ambulatory clinicians continue to use handwritten recipe cards that don't give the materials manager the data they need to evaluate supply consumption. These handwritten cards are comfortable for the clinical team, but don't provide any data. And in some situations, the facility may not have or utilize an automated system. Without the visibility that data can provide, it's difficult, if not impossible, to align your inventory levels with actual product usage. And as a result, purchasing again is driven by that just-in-case practice. And there are more examples of supply waste in the OR as well. Product duplication is a major contributor to waste and a significant barrier to managing your OR inventory more effectively. There's not a day that goes by without some new and better product being introduced into your OR. And rarely, if ever, is there clinical evidence to prove that this new widget improves patient outcomes. And frequently, when the new widget arrives, the old one never leaves. To sum it up, product duplication drives supply costs up in the operating room. For example, just think of all the glove types from all the different glove vendors that you're probably stocking right now. Ask yourself, are there some duplicates you could eliminate without impacting patient care? And the broader question, what can you do right now to take better control of your OR inventory? There are several opportunities, including product consolidation, product consignment, product standardization, improved acquisition and distribution processes, and instituting a process to control new product flow and vendor access in your OR. So what's the first step in putting these opportunities into action in your own center? Improving your OR inventory management starts by bringing all of the right people to the table. Organize a supply chain team that includes your leadership, materials managers, physicians, and clinical staff. It's critical to educate these stakeholders, and accessing and presenting the facts is the first step in addressing the problem. Those facts include the actual cost of supplies, the cost of product duplication, variations in procedure costs, and the cost of excess inventory. In fact, simple variations in how your clinical staff set up their back table can drive additional costs. So depending on the stakeholder, the content and impact of the information you provide will vary. For nurses, it's the realization of knowing what supplies actually cost. I've seen facilities add the cost of supplies to the shelf where staff are pulling their cases. I've also seen the cost of supplies added to charge tickets, preference cards, and pick lists. These practices raise awareness and encourage staff to pause before opening something that may not be needed. Another facility that provided profit sharing to their employees was undergoing a custom pack review. The initial feedback from the clinicians was that the number of towels in all of their packs were absolutely necessary, but our observations didn't support this. So with permission from the clinical director, the number of towels in each pack was written on the schedule along with the cost of the towels. It became a competition to see how many towels were actually needed in those packs to support their clinical needs. This particular facility ultimately saved over $21,000 on the cost of towels alone. For physicians, benchmarking their cost per procedure definitely gets their attention. In an ambulatory setting, this has a definite impact on distribution checks and profit sharing. The next step to educate your stakeholders is just as critical, but also fun and enlightening. Have your entire supply chain team do a walkthrough of your OR operations with these points in mind. During this field trip, you need to visit all stocking locations. Look for duplications and excess inventory. Open the drawers and the doors. Look for your mission bin, because that's where unused product usually ends up. You need to observe the case pick process, review your pick list for accuracy and have available items, and evaluate those daily returns from the OR, items that aren't used. And after your walkthrough, have your group sit down and review their observations. Once stakeholders see your OR inventory issues firsthand, you'll be in a better position to gain the support you need to solve the issues. And once you have that buy-in, what strategies can you use to begin improving OR inventory management right away? An initial step is consolidation of like products. The most painless and effective way is to select non-physician commodity products first. Most operating rooms have an excess of like commodity products such as shoe covers, bouffant caps, soaps, hand sanitizers. Consolidating these commodities can be as simple as moving from 3 vendors to 1. And another way is to reduce the number of OR locations where items are stocked. Try to pick one primary location, and I like to try and pick that location as close to the point of use as possible. You can also combine individually pulled products into procedure-specific kits or packs. These kits can either be standard or custom configured. So work with your vendors to develop appropriate kits for those high-volume, supply-intense procedures. Always make sure your kits are based on actual procedure volumes, and remember to group similar draping practices. Also, be sure to review those kits annually for item changes, waste elimination, and practice changes. Consistent items in a mission bin or blue towels stacked around your OR are a good indication of waste. As part of this review process, you also need to make sure you include your preference cards, case cards, and return cards. There are additional strategies for improving inventory management as well, such as looking for consignment opportunities. I think we all do a good job with the consignment piece, so you need to make sure that you're working with your vendors to identify opportunities for those high-cost products, such as orthopedic and spine implants, lenses, and see if you can include the instrumentation that's needed for these implants. When you do use consignment, you need to be mindful of challenges that consignment brings. These include making sure that you're keeping an accurate account of what products are placed in the facility. You need to encourage vendors to keep your consignment product to a minimum. And you need to determine who's going to manage those expiration dates. Excess expired or soon to expire product is usually, again, an indication of too much inventory. Next, let's move on to product standardization. Just 34% of ambulatory centers use product standardization as a supply chain strategy, but it can be a powerful tool to cut waste and lower costs. Your center will need leadership to drive this cultural change and need to stand firm in every decision to standardize. And again, the best place to start is those commodity products that have little or no clinical sensitivity or impact on physicians. As you implement your standardization strategy, work on reducing multiple and duplicate SKUs, require clinically acceptable alternatives for products, and it's not always going to be the least expensive item available. Look for opportunities inside and outside of your custom kits. Do your kits have different size back table covers or different lengths of suction tubing? This is another opportunity to standardize. And to gain buy-in from clinicians, involve your vendors and sales specialists in product trials or sampling. And for other products such as drapes and gowns, implants and sutures, there's good opportunity there. Duplications frequently occur in your suture inventory. The same suture and needle may be stocked in 18, 24, and 36-inch lengths. One of the roadblocks to standardization is variation in equipment. Different vendor equipment performing the same function can require different disposables. The disposable cost associated with capital purchase should be taken into consideration before the purchase is made. For example, replacing your surgical lights in the OR, the cost of disposables can be as little as 50 cents each to $15 each, depending on the disposable camera and light covers needed. The next strategy for better inventory management is controlling the flow of new products and vendors into your OR. An unrestricted flow of new products and vendor access can result in tremendous waste and needless cost. To turn this trend around, the first step is to establish and enforce a policy and procedure on new product entry. Next, you need to establish a multidisciplinary committee to oversee requests for new products. And the third step is to control vendor entry and access to your staff. This way, you can avoid the introduction of trunk products into your OR and selling behind the red line. Now that we've covered several strategies for helping you gain greater control over your inventory, what else can you do to reduce waste and costs while improving efficiency in the OR? We recommend expanding the scope of your action plan to include critical clinical practice issues such as eliminating waste. Often scrub techs will scrub in to set up a case, then break scrub before the patient enters the room, requiring them to open an additional gown and pair of gloves when it's time to start the procedure. This practice costs around $4. So imagine if every scrub tech did this same practice for each procedure. In an average size ASC, 5,000 procedures are done annually. This unnecessary and wasteful practice costs the center around $20,000 a year. Review your practice for draping and overdraping. Eliminating this practice is an excellent way of reducing cost. And many times the overdraping is related to back table and Mayo stand setup, not patient draping. Remember the cost of those towels. Choosing the right product for the right task. One facility was opening 12 surgical gowns to create a bump for a surgeon to use during a total knee procedure. This cost was around $50 per procedure. If the facility had used towels for this purpose, it would only cost around $15 a procedure and still meet the clinical needs of the patient. Selecting appropriate drapes and gowns based on AMI levels for each procedure will also provide the right level of protection and may lead to cost savings as well. Do you really need AMI level 4 gowns and heavy-duty back table covers for cataract procedures? And converting to clinically acceptable, lower-cost product alternatives is a great strategy. To sum it all up, we've discussed why focusing on OR inventory management is important and how improving it can increase your efficiency, cut waste, and lower cost. We've also shared several strategies that you can use to improve your OR inventory management, which include not only focusing on traditional supply chain activities, but also your clinical practice. So your next question may be, how do I put my plan into action? And that's exactly what we're going to discuss next. To put your own plan into action, your center needs to take these 7 steps. The first thing you need to do is establish the baseline of what you're trying to accomplish. To get where you want to go, you have to know where you are today. Do you want to reduce inventory dollars, reduce your SKUs, reduce your cost per procedure, or reduce your overall supply spend? You need to set specific and measurable goals to help you get there. You need to assemble and educate your team of stakeholders. Determine the appropriate solutions that you want to implement and develop your action plan for implementation. Next, you need to operationalize your plan. And the final step is to make sure you measure your success. Thank you all again for your time and attention today. I'm going to turn it back over to Mackenzie for questions from the audience.
Thank you, Marvella, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We'll try to get through as many questions as we have time for. So it looks like a lot of great questions are already rolling in, and the first one is, it's challenging to truly understand how much waste we are reducing. What are your recommendations on how best to measure and quantify waste reduction?
Well, a good way to quantify is to track unused items after procedures. If you track for a 2-week period, statistically, that's supposed to identify about 80% of what's being wasted on a regular basis. So have staff save items that aren't used and put dollars to those items. If the items are coming from custom packs, then those items may need to be removed. And if they're coming from single sterile items that are picked, you really need to take a look at your preference cards. And do these items need to be picked for those procedures? It's also important to reduce your waste to segregate hold items during the case pick process. This, a lot of times, keeps items from being opened unnecessarily. You need to constantly measure your progress and document your savings. And look for waste in other areas as well. You know, waste is not only in product, it may be in time and it may be in resources.
Great, thank you for clarifying that, Marvella. Another audience member says, today we are picking cases 5 days in advance, making it challenging to find space for storage. What are best practices for how many days in advance to pick for a case?
That's a great question. And a lot of folks are challenged with space. And picking 5 days in advance not only challenges your space constrictions, but it also increases the days inventory on hand you need. You actually have 5 days of inventory on those case pick, whether it's carts or baskets, but you have 5 days of inventory in your case pick alone. And that's not in addition to the items you have on the shelf. So usually I recommend, and what I see most folks doing, is picking 1 day in advance. And primarily that's because they do have those limitations of space and really don't have space to store more than 1 day's staging.
Great, thank you for sharing that best practice. The next question is about inventory on hand, and the question is, if products are delivered to me twice a week, how many days of inventory should I keep on hand?
Usually we recommend 4 to 5 days of inventory on hand if you're getting 2-time-a-week delivery. This way you can meet your current demand and moderate any changes in demand when they happen. But it's also important to take into account any consistently high volume days and prepare in advance for those. If you have one surgeon that performs 10 procedures every Tuesday, that volume will have to be increased on the supplies needed for that surgeon's procedures.
Thank you for pointing that out. We have another audience member who says, "It's sometimes hard to motivate my staff to participate in these kinds of initiatives or programs. Do you have recommendations on how to incentivize my clinical staff and materials manager to get them on board?"
Well, when I was working in the ambulatory setting, we tried to raise awareness and increase awareness of the cost of supplies by making a game of it. We put our supply costs next to each item on the shelf. We added the supply cost to all of our charge tickets and preference cards. And then we tested the team's knowledge once a week during morning report. We played "What's the cost of this widget?" and the team members who could identify the cost of that item were given a gift card or, some other form of reward. We had a lot of fun with it, and it actually helped the team pay more attention to the cost of supplies and really to think about opening something that may not be needed. So to get your team involved, try to make it interesting and fun for them.
Absolutely. I think that is a great point. So it looks like we have time for one more question. And the last question is, what's the best way to change practices that don't add value or help to improve outcomes?
That's a difficult one, and from my experience, I've seen successful ambulatory centers review AORN recommendations with your staff. These are the gold standards of practice and can help the team to understand why a certain practice is not clinically advantageous or why it is helpful in improving patient outcomes. AORN has also modified some of their recommendations in recent years to address the different resources that are available in the in the ambulatory setting. Find articles or white papers in journals or online that provide clinical evidence on practice results. Do a lit search to support a practice or to prove that a practice may not be the best in your situation. Review the annual cost of certain practices that don't improve clinical outcomes and present those to your staff as well.
Great. Thank you again, Marvella. That is all the time that we have for today. I want to thank Marvella for her excellent presentation and to Cardinal Health for sponsoring today's webinar. Please enjoy the rest of your day, and we look forward to having you join us for future webinars.